This video will demonstrate the performance of the techniques utilizing the newly introduced PEG-24 percutaneous endoscopic gastrostomy system, manufactured by Wilson Cook Medical Incorporated. Each feeding system incorporates a detailed patient care manual and instructions for use. These instructions are conveniently located outside the tray, so one does not have to compromise the sterility of the tray. The patient care manual should accompany the patient as it provides necessary information for the caregiver. There are three methods of providing feeding through the Wilson Cook PEG-24 system. The first is the PEG-24 pull technique. The second is the PEG-24 push technique. Both of these are for gastric feeding. The third is the PEG-J1224 for jejunal feeding and gastric decompression. The soft, flexible tulip tip eases passage and provides a secure seal preventing leakage. The PEG-24 feeding tube and dilator is extra long, more than 35 inches, permitting gradual dilation of the stoma tract. Highly visible centimeter marks aid in placement and care. An X indicator on the PEG-24 assures optimal length for GJ tube placement. The PEG-24 features a 24 French feeding tube with a large 5.5 millimeter lumen, the largest lumen of any externally removable PEG product available. The larger lumen provides up to 84% greater flow rate than the standard 20 French feeding tubes. The Wilson Cook PEG-24 system includes all items necessary for PEG placement. The top tray or access tray provides the items necessary to prepare the patient for the procedure. The bottom tray provides a sterile area for convenience during PEG placement and contains the necessary implements to finish the case, including the PEG-24 feeding tube, wire guide, bolster, and bolus and universal adapters. The unique pivotal external bolster included with each PEG-24 set is designed to prevent pressure necrosis by allowing full 360-degree rotation of the tube. The special contoured underside of the bolster provides minimal skin contact, better aeration, ease in cleaning the stoma site, and reduced inflammation and irritation. The clever twist lock included with each PEG-24 fastens around the neck of the bolster and holds the tube securely in place. It can be easily locked and unlocked for repositioning the bolster when necessary. Provided with each set are two feeding tube adapters. These adapters are made of flexible plastic to resist stretching. Stretching of the adapter can lead to an improper fit of the delivery set, thereby causing leakage or disconnection. The universal adapter has a main port and a side port. The main port of the universal adapter accepts all delivery sets, whether pump or gravity feeding. The side port of the universal adapter accepts any catheter tip irrigation syringe for inline flushing or delivery of medications without having to disconnect the feeding set. The bolus feeding adapter can be used instead of the universal adapter if piston syringe feeding is the method of choice. The bolus adapter will accept pureed food. The bolus adapter is the same inside diameter as the PEG-24 tube, so there is no constriction of flow.